Hello, welcome. Thank you for joining our live event with Forrester. Before we get started, a few logistical reminders. This is a live event and it is being recorded. Anyone who registered for this event, whether you're attending with us live here today or not, will receive a link to the recording within 24 hours. If you have any questions during the presentation, don't hesitate to send them in the chat. We'll do our best to answer your questions during the session. If we don't get to it, we'll follow up with you so we can continue the conversation. My name is Shelly Waymeyer, and I lead product and partner marketing at Rhapsody. I've dedicated my career to simplifying the complexities of health and social care delivery worldwide with technology. My time spent in the industry learning from clinicians and tech administrators has taught me that getting the foundational data and integration layers right pays off exponentially, as that value is realized in the applications layer and ultimately in the user experience and patient experience. Recently, I had the opportunity to engage with Rachel from Forrester to prove that out in terms of dollars and cents, or your currency of choice. And that is why we are here today, to hear Forrester's unbiased findings about the hard ROI of partnering with Rhapsody for health data integrations. With that, Rachel, I'd like to turn it over to you to introduce yourself before I give a brief introduction of Rhapsody.
Thanks, Shelly. My name is Rachel Ballard. I am a senior consultant at Forrester within the Total Economic Impact practice. Thank you so much for having me, and I'm looking forward to the opportunity to sharing our findings around the Total Economic Impact study of Rhapsody.
Awesome. Thank you, Rachel. Well, just a short detour on the path to digging into the findings in the report. I wanted to give a brief introduction of Rhapsody and the challenges we're seeing in the market. Through working with over 1,700 customers across the globe, we have developed a strong point of view on the challenges of connecting healthcare data internally in an ecosystem and externally to data trading partners. From the lens of digital health solutions providers, we know that connecting to EHRs is not one size fits all. The complexities that come with solving for that put time to market under pressure and ultimately distract from the core competencies and differentiating value of the digital health solution itself. Even with the introduction of FHIR and recent and not so recent data sharing regulations, there are inconsistencies in workflows, standards, and systems used that make each customer's ecosystem and ways of sharing data unique. Connecting to 3 different EHR systems will get you only to 75% of the market. And even then, each health system connection within an EHR system is one-to-one. After connecting to one customer's EHR, you've connected to one customer's EHR. Plus, any single health system may have multiple EHRs. Cerner and Epic, certainly, and then also smaller specialty-specific or community-specific systems that need to be integrated. The number of systems outside the EHR continues to grow as well, as provider organizations invest in analytics tools and patient engagement technology. This creates an additional number of systems that need to be connected internally and that digital health solutions providers need to consider as they onboard customer data. So on the path to building AI models, connecting to onboard customers faster, creating seamless care, there are some tangible hurdles and barriers that need to be removed to ensure they are not a hindrance on the path to those value-driving initiatives and programs that your organization is accountable for. The Rhapsody Digital Health Enablement Platform supports use cases across your enterprise. The platform offers flexible capabilities to support connecting data and standardizing patient and terminology data for quality. It can be deployed on your infrastructure or on ours. And the modern, complete, and composable solution means you use and pay for the parts you need to exchange quality data within your ecosystem and outside of it, using FHIR or any REST or SOAP APIs, leveraging US CDI and your own proprietary standards. All right, so now let's dive in further. And Rachel, I'll turn it over to you to give an overview of how we'll break down your findings.
Thanks again, Shelley. So the TEI team at Forrester has a long history of helping companies quantify the benefits of the solutions they offer. Forrester does this as an objective third party and is able to leverage its expertise across different technology domains. So Forrester led this study of Rhapsody's healthcare data integration solutions. And again, I'm very happy to be here today to talk to you about the study and what we heard from Rhapsody customers. To that end, I'll walk you through what is TEI. I'll give a brief summary of what the customers experienced before adopting Rhapsody. I'll give some detail and examples of the customer journey, and finally share the study results. Before moving on, I do want to emphasize that this presentation is an abbreviated version of a much more comprehensive study, which if you've not seen it or downloaded it yet, you can find the link within the webinar chat. Next. So the TEI methodology has become important in today's climate because more and more buyers are seeking formal business cases to justify their technology purchases. And for that reason, it's important we look beyond the traditional roles and capabilities of IT costs and IT cost savings. We really need to evaluate the investment impact on the business organization, and to look at risk and strategic implications such as scalability and flexibility, because of course, decisions today can impact your business several years down the road. Before getting to the specifics of the Rhapsody TEI study, I just wanted to share the multi-step approach to the methodology. We did some due diligence. We interviewed some internal people at Rhapsody. We also interviewed Forrester analysts who are subject matter experts in this space. And then we looked to the analysis on 4 customers. And what did the customers tell us? And based on the customers' responses, we then built a financial model that is included in the written case study, and we get to where we are today. It's wrapped up and available. So throughout this process, I do want to clarify just a few points. The customers that we interviewed were provided and introduced to Forrester by Rhapsody, but Rhapsody did not participate in any of the customer interviews. Forrester retains full editorial control of the study, and this study and this presentation do not provide an endorsement of Rhapsody. So just this is a brief overview of the results. Forrester found in its analysis that the composite organization realized a return on investment, or ROI, of 193% over a 3-year period. The total benefits equal $2.4 million, and the net present value, or NPV, of our analysis resulted in a $1.6 million benefit. So I have included a quote here from an interviewee that I thought really reflected what we heard surrounding the investment impact of Rhapsody. By leveraging Rhapsody, we can save valuable resources and focus on our core competency. Trusting the experts in software integration allows us to optimize our investments and achieve unparalleled efficiency. Let us leave the data intake and acquisition to those who know it best, so we can excel in what truly matters to us. So that being said, let's get to the study. What did we find out about the Rhapsody investment? So again, we started by interviewing 4 different Rhapsody customers, and while all interviewees were health organizations and managed application integrations and interoperability, they also shared different experiences. So one was a VP for a healthcare provider within a large integrated delivery network, or IDN, who wanted to drive more streamlined interfaces across the network. Another was a CIO for a health technology organization specializing in AI surgical platforms, which is a young organization just beyond the startup phase. Another was a chief technical architect for a very large global health tech organization specializing in medical device software and hardware, whose organization we consider an OEM. And the last, an integration contractor for a health tech specializing in patient engagement software, who was looking for something much more robust than their customized homegrown solution. The customers vary greatly in use cases, revenue generated, location, numbers of employees, numbers of connections, and legacy solutions. However, they all had similar challenges that they sought to ameliorate through the adoption of Rhapsody's healthcare integration solutions. For example, these customers struggled with unstructured, unconsolidated approaches to connecting patient data, needing customized processes for every connection. They also lacked the required expertise across the internal integration development team, resulting in inefficiencies. And those customized integrations were both time-consuming and resource-heavy. So given those challenges I mentioned, the customers discussed why they sought a solution like Rhapsody. What do they need in a solution to overcome those issues? One, the ability to scale connections with a standardized protocol. Interviewees said that Rhapsody helped standardize protocols to allow communication between healthcare systems. This allowed them to scale their network of connections without compromising data integrity. The ability to configure data more accurately and quickly. Interviewees selected Rhapsody because it simplified data mapping and transformation. Also a strong reputation that was recognized across the industry. Interviewees selected Rhapsody due to its reliable and trusted reputation in the healthcare space. So given these different needs and characteristics, you see that we have to build a set of assumptions around which we can build a financial model. And that in TEI speak is called the composite organization, which is a hypothetical company that fairly represents a Rhapsody data integration customer. It's also assumed based on the interviews that prior to Rhapsody, the composite organization relied on several homegrown custom integration point solutions, struggled with inefficiencies and budget constraints. And there are some other assumptions made by Forrester that are required for the financial model, not mentioned here, but are very clearly defined in the full study. So the reason we built this and the reason you want to refer to the more comprehensive study is that you can adjust all of the assumptions throughout the study based on the specifics of your organization. So readers can apply the TEI data to their own organization by extrapolating the benefits and investments to the composite. By using these methods, health system readers can tailor the insights from the study to better reflect their unique financial and operational contexts. So for larger organizations, you can say, well, we have $200 million in revenue and 100 patient data connections per year. So you can start to adjust that math and say, okay, based on the companies that Forrester interviewed, the impact of my organization would be X. One health tech organization larger than the composite, for example, had $100 million in revenue compared to the organization and 20 years of experience using Rhapsody with a long list of products that require Rhapsody's integration engine. According to this particular interviewee, they save tens of thousands of hours per year. So scaling the model to accommodate these larger numbers might result in higher benefit values and a higher ROI than the composite. And healthcare providers, you may have 10 to 12 business organizations across the business that are connected and impacted by Rhapsody, whereas they might have been previously siloed. The provider interviewee, the Forrester interviewed, shared that they were able to streamline workflows, improve data exchange across departments, increase revenue through automation, creating efficiencies for employees, and enhancing delivery output, all of which contribute to better patient outcomes. And here is another customer quote from a CIO at a health tech organization that I think highlights the before and after environments. So with our point solutions, we would have had to establish multiple integrations multiple times. For example, we would have to integrate one product deployed in 20 hospitals 20 times. Now it just takes one time, and we can take that data and use it anywhere we want. So now let's talk in more detail about the financial analysis itself based on the customer's responses. First of all, we were able to identify 4 different quantifiable benefit categories, and I'll go into these in a bit more detail, but to outline them for you now, the first quantified benefit is avoided integration engineering and analyst hires. The second, improved time to market. The third quantified benefit, business acceleration and incremental net operating revenue attributed to improved deployment experience. And finally, we have improved engineer and analyst efficiencies. So as promised, a little more detail. Again, the first quantified benefit, avoided integration engineering and analyst hires. So with Rhapsody, the the composite organization streamlines healthcare interface development. Its engineers benefit from intuitive tools, standardized protocols, scripting components, and scalability. This all reduced development time compared to the manual integrations that they had to employ before. So Rhapsody enables the composite organization to avoid the cost of 4 additional engineering and analyst hires, and empowers its integration engineers to work efficiently and focus their time on strategic tasks and achieve better outcomes. So the organization achieved a $1 million cost savings benefit over 3 years. And supporting this benefit, a chief technical architect commented, "Embracing automation is the key to unlocking efficiency in healthcare. By eliminating the burdensome tasks of clinicians, such as manually capturing ECG data and managing multiple integration solutions, we can save thousands of hours each year. And with this newfound time, clinicians can focus on what truly matters, providing the best possible care to their patients." So that may be meaningful to some of you. Then we have improved time to market. Interviewees told Forrester that Rhapsody improved their time to market compared to prior integration methods. Rhapsody tools streamline the integration creation and configuration process, allowing for quicker system integrations. Efficient data exchange, ensure adequate communication between applications, all leading to faster development and deployment cycles. Forrester assumed that the composite improved its time to market by 30 days, which resulted in an operating revenue gain totaling nearly $800,000 over 3 years. Next is business acceleration and incremental net operating revenue attributed to improved deployment experience. So as recently mentioned, Rhapsody enhanced data exchange, streamlined the integration processes, ensured higher accuracy, and sped up time to value. And with these functionalities, organizations can enhance the deployment experience for customers and provide opportunities for additional net revenue. For the composite organization, for example, Forrester assumed a 5% increase in net new operating revenue. And supporting this assumption, the chief technical architect at a healthcare technology software development organization said, "Rhapsody has improved the bottom line financials for sure, because it's an incredibly important part of the solution." Separately, an integration contractor told Forrester, "As an estimate, our revenue increased 10%, and that's because of integration." So the financial impact to the composite organization over 3 years totaled $336,000. Lastly, improved engineer and analyst efficiency. So the integration development team saves considerable time avoiding unexpected disruptions for deployed interfaces, saving the team 5 hours per disruption. Furthermore, thanks to a better experience for engineers, clients also benefit from not having to spend time onboarding replacement resources. So in fact, one interviewee called Rhapsody a critical system and integral to their delivery of care. So by centralizing patient data integration capabilities with Rhapsody, the composite organization was able to optimize operating overhead, driving further cost savings and enabling more focus on innovation. So this resulted in a $242,000 benefit over 3 years. There were a few additional benefits included in the study that the customers weren't able to quantify, but I believe are very important to mention. One, enhanced customer and patient experiences that promote confidence. So Rhapsody ensures effective data exchange between and within healthcare systems for the composite organization, leading to accurate patient records and timely information sharing. More efficient workflows and improve the employee experience. So due to the centralization and consolidation of necessary data, Rhapsody simplifies and streamlines engineer workflows, so it reduces the burden on its internal teams. Better security control standards. The organization benefits from Rhapsody's secure data exchange environment, which helps it ensure compliance with global data privacy and the protection of regulations, which maintain customer and patient trust. A strong relationship with the Rhapsody team. So the organization benefits from a close and responsive partnership with the Rhapsody team, which provides timely assistance and immediate problem solving. And lastly, improving data quality. So by centralizing its integration processes and data, the composite organization can identify areas of poor data. So this ensures improved data quality and stewardship processes, benefiting end customers. And lastly, to do a return on investment, we have to have both benefits and costs. Of course, the Rhapsody solution is not free. It carries a cost, and we looked at that. And we first calculated the fees to Rhapsody, which have a present value cost of approximately $400,000 over 3 years. And we also looked at the costs incurred surrounding initial implementation and ongoing maintenance. So the initial costs included internal integration resources and initial training, while the ongoing costs include the management of the platform and ongoing training. And these costs total approximately $430,000 over 3 years. So we've talked about benefits, costs, flexibility, and risk as important factors that contribute to a return on investment, or ROI. In terms of best practices in calculating an ROI, the TEI team at Forrester also needs to consider the right metrics, industry standards and benchmarks, operating profit margin depending on the type of organization, an attribution assignment when it comes to revenue benefits. And these inputs and assumptions are reviewed extensively within the TEI team and with subject matter experts, as I mentioned, to deliver a realistic yet conservative ROI to clients. So as a result of that analysis, the inputs, variables, and assumptions, you can see how the Forrester TEI team, through its methodology, came up with the math and reached a calculation of 193% ROI and an NPV of $1.6 million. And that is the total economic impact of Rhapsody's healthcare data integration solutions. I thank you for your time and look forward to your questions.
Great, thank you, Rachel. That's a quick summary of a lot of work that I know you and the team put into gathering the data and putting together the model to apply. So thank you very much. We did get some questions come through while you were speaking, held a few to the end here. A couple for you, a couple for me. Rachel, how about I start with one for you?
Okay.
All right, so it says, how do these results compare to other ROIs that Forrester has put together for B2B tech purchases or within healthcare?
Question. So, as I mentioned, Forrester is an impartial third-party organization and believe in, plausible ROIs, and we take a very conservative approach within our methodology. So typically we are seeing ROIs in the double digits, with some over 100%. And so these results are very strong and healthy.
Great. Certainly glad to hear that. All right. One question that came in the chat is, how does this apply to health tech companies building AI? And I can take that one. I think any of the testimonials here and the findings absolutely apply to health tech companies focused on building AI. In fact, one of the customers interviewed, as it called out, one of the health tech organizations interviewed is building an AI platform for a surgical solution. And I think the themes worth calling out here is any of the comments relating to scalability, knowing just the amount of data that's required to build AI. It's taking the challenges that are seen in smaller scale situations and just amplifying them as the amount of data and amount of data sources has to increase to support what it takes to build those AI models. And then one of those unquantified benefits that was called out is the value of the Rhapsody digital health enablement platform for enforcing data quality. So as that data is moving in and out, applying identity management and terminology management via APIs to ensure that the data is ready to go for the data scientists building the AI when it lands. I'm happy to talk about that further. you can reach out to our team using the QR code on the screen. All right, one more question for you, Rachel, that came through. How should organizations think about identifying and prioritizing use cases prior to implementing an integration solution?
Well, I think creating a customized business case using the results of this TEI can really help a healthcare organization understand the benefits of Rhapsody, how they might apply to their organization, and how to prioritize them. Obviously, and subsequently plan its implementation and budget the necessary resources.
Yeah, that makes sense. I think, one thing that became obvious to me as I was reading, some of the output of the interviews you had, it's like this could be a decision that's easy to put off sitting at that middleware layer, but as soon as that change is made with operational efficiency in mind, it changes the mindset of this being just a means to an end, or possibly a liability, to being an asset, because it's freeing up the teams to work on more value driving work, right? Like we're getting further on that roadmap for those features that are going to differentiate their products in the market, versus spending so many cycles on the data connections and data access itself.
Yeah, I agree with that. And of course, we only interviewed 4 customers, so our exposure to the many use cases was somewhat limited. But across all of them, we heard they wanted the ability to standardize the integration process, right? And the equipment for better, more efficient and accurate data exchange, across systems within an organization.
Yeah,
I agree with that.
Great. Another one for you. Where are customers most commonly reinvesting the money saved and the net new operating revenue, as we saw through this report? I guess whether it's, I guess in general across this report and the others that you do, where do you most commonly see that money saved in net new operating revenue and reinvested in the company?
Yeah, I think in the studies that I have done, technology companies are typically reinvesting NPV savings realized from investments in a few different ways. We have further technology upgrades, maybe research and development. We also have employee training and development. I've heard debt reduction and expansion initiatives, which of course is pretty broad, but you can imagine what that might entail.
Yeah, that aligns really well to how we typically frame up, and one of the visuals I use to support this point kind of calls out what are those value driving initiatives that need focus, where integration can be a blocker, and a couple of them align with what you just said. One, new market entry or global expansion, global scalability. How do you free up resources to do that and get the data you need to do that? In R&D, right? How do you get further in the innovation roadmap? Step away from the operational needs of the solution to figure out what's next.
Right.
Yeah.
Because of course, with these efficiencies, people are freed up. So
yeah,
to think about, more strategic initiatives.
Yeah, absolutely. Hey, on that note, I don't think I can beat a way to wrap up our time together today than that. How to free up your team for more strategic initiatives. If you want to work on a business case with our team using this model, this unbiased model from Forrester, please reach out. You can contact us on the website. If you're here with us live or on the recording, you can also scan this QR code, and someone from our team can work with you to build a business case for your own potential cost savings and revenue growth. So thank you for those of you who've listened to this report out. Rachel, thank you for the time and expertise from your team and for bringing this forward with us on this live event.
My pleasure. Thank you so much, Shelley.
All right. Bye.